My favorite thing about treating patients is going on the journey with them. So I see somebody that comes into my office in a lot of pain, has limited function in their life, and is really upset with what's going on, particularly for me seeing hip and knee arthritis. Then treating them for that condition, and ultimately perhaps they undergo a joint replacement, seeing them get that function back and their quality of life back is really the thing I enjoy most about my job. So I grew up here in Plano, Texas, not far away from where we are now. My parents actually still live in Plano. I graduated from Plano West, then I went to Cornell University up in upstate New York, studied engineering, came back down to Texas for medical school at Baylor College of Medicine in Houston, Texas, then back to Dallas for residency at UT Southwestern in Parkland. I did a fellowship in hip and knee replacement at OrthoCarolina in Charlotte, North Carolina. I do hip and knee replacement for the most part, so that includes first-time hip and knee replacements as well as redos or revisions of previously failed hip and knee replacements. I do a little bit of trauma, fractures as well, but I'll see anybody who's age 18 years or older. New techniques that I'm a big supporter of is the direct anterior approach for hip replacement. This is a minimally invasive technique that doesn't cut any muscles or tendons around the hip, and I find that patients that have a direct anterior hip replacement tend to recover a lot faster than more traditional approaches. So I really think people recover quicker with this approach. Some of my hobbies are playing golf. I really enjoy that and being outside. Recently I've started training for the Dallas White Rock half marathon. My father is a big marathon runner, and so he and I have decided we're going to train together and run the half marathon in December.